All right, let's get to it. Okay, finally, Mama V will get answers to our questions, right?
Are you sure, Kojo, that that's not a question for a guy? I know
It's a
Dr.
question for
Selormey knows
everybody.
that that's a question on your hearts.
It's a question for
I
everybody,
smell
Mama V.
mischief already.
I don't even know why Mama V thinks this is a problem for guys. Do we do it with ourselves? All right, Dr. Yao Amankwah Boateng is a senior maxillofacial specialist at 37 Military Hospital. He's a fellow of the Ghana College of Surgeons. He's a member of the Ghana Medical Association, and he's a guest on the Super Morning Show. Dr. Richard Selormey is acting general secretary of the Ghana Medical Association. They've got a big event coming up. He's going to tell us all about it, in addition to helping us with education on head and neck cancers. Gentlemen, thanks again for your time.
Thanks for having us.
All right, so maybe we'll start with the big word, maxillofacial. What on earth is that? What does it mean?
Well, maxillofacial surgery is that discipline of medicine and dentistry. It's a blend of both worlds, let me put it, that deals with, when we say maxilla in anatomy, it has to do with your jaws.
Oh.
And as for facial, I think Mama V can describe it in its fullest
So
terms.
that's all it means?
So
Yeah.
what we are talking about is that discipline that deals with defects, injuries, infections, and other conditions that affect your oral maxillofacial complex, your jaws, your cheeks, the associated tissues, the skin, the head and neck area, essentially,
Right.
from your lymph nodes to your tongues to the entry points of your throats and those things. Yes.
Interesting.
That's a first for me. Thank you for explaining
Yes.
that.
So just to add a bit, you see maxillofacial surgeons doing various things. So tumors of the jaws, the tongues. Then there are also subspecialties that deal with plastic surgery, like facial plastic surgeries, like nose issues, the lips. Then the
Right.
cleft lip and palate work, and many other disciplines. Yeah.
From now on, I'm going to refer to passport photos as maxillofacial images. All right. So now we get it. We understand what maxillofacial surgery is concerned with. All right. So now let's try and understand these head and neck cancers. I suspect there's more than one type of head and neck cancer. Maybe you can give us a bit of background to them.
Yeah, so head and neck cancers essentially, as the name implies, cancers of the head and neck region. Like you rightly said, there are subsites. So when we look at head and neck cancers, we are looking at cancers of the oral cavity on a layman's term, the mouth, cancers of the throat, and then cancers of the voice box. We would also want to include cancers of some glands that produce saliva into the mouth and some spaces in the head. But it excludes cancers of the brain, cancers of the eye, and then the thyroid cancers. So basically that is what head and neck cancers are about.
Okay. So brain and eye not included.
Yes.
So it's just cheeks and mouth and
So essentially the areas Dr. Selormey mentioned when he was taking us through what maxillofacial surgeons do.
right.
And just to add, don't forget that the skin and other tissues around there are all part
All included.
Yes.
Right. What causes head and neck cancers?
Okay, so commonly what the exact causes we'll say are unknown. So we usually talk of risk factors or predisposing factors. And the two most common ones are alcohol and smoking. And if you are doing both, it has a synergistic effect. So if you smoke and drink in addition, then your risk is even higher. However, in recent times, personally, I'm seeing a lot more of my cases who do not smoke nor take alcohol. So we are beginning to look more at the other causative factors. One that readily comes to mind is infections, certain viral infections, most commonly human papilloma virus. And so I'm sure that is where your question or Mama V's question will come.
Mama
back.
V's question.
Yes, so infection with the human papilloma virus, the same virus but different variants that causes cervical cancer can also cause cancers in the mouth. There are other viruses like the Epstein-Barr virus that also causes cancers in the throat, so nasopharyngeal cancers and other cancers in the mouth. There are also occupational exposures. So we have exposure to wood dust, to nickel, to asbestos. And so people who work in the logging industry, the construction industry, metal, textile, ceramics, may also have some predisposition. Underlying all of this, you'd have some genetic predisposition as well. So if there's a family history, you have some concern. Then radiation exposure. So in one bit, we use radiation to treat the cancers, but some exposure to radiation can also cause a cancer. So you may have cancer in some other parts of the body whilst you are taking the radiation, and that is why they give you some protection of the other organs. So if you receive radiation to these organs, that could also lead to cancer. There are other minor ones, especially in a setting where we are getting a lot more of non-smoking, non-alcoholics. We may have to look at things like malnutrition, because we know some foods are able to protect you. So things like malnutrition, maybe some underlying stress, and a host of other things.
Would you say there are just about as many non-smoking, non-alcoholic, maxillofacial, cancers as there are smoking and alcohol-related ones?
Yes, so by the epidemiology, these are the two common ones, the alcohol and smoking. But increasingly, because now you realize that most people are not smoking the pipes. I mean, they smoke tobacco. And as that is decreasing, that may also be accounting for why we are now seeing more of the non-smoked, non-alcoholics. The other bit is that I think COVID has taught us that lesson. We tend to take data from elsewhere. So locally, we are beginning to realize that, well, if you consider Asia and say Africa, the smoking predisposition or the number of people who smoke, if you compare that to Africa, there's a vast difference. So we are beginning to realize that we need to do our own local research and look at these other factors, because they will be contributing more than we know.
So let's put Mamavi's matter to bed once and for all. Okay. So clearly it's a causal factor, this human papilloma virus, okay, which is the same virus that causes cervical cancer. So the link is quite easy to draw. That and I'm guessing that men are getting this perhaps a bit more than women.
Exactly.
All right. So oral sex.
Oral sex. Yeah.
Now, cigarettes come with a warning, medical warning. So does alcohol, actually.
Yeah.
Should we put a medical warning on oral sex?
Okay, so the issue of oral sex is dicey, like we've established. There are variants of the human papilloma virus. So there are those that cause the cancers in the mouth. There are those that cause the cancers in the cervix. We are looking at risk factors. So once you do oral sex, your risk, as opposed to somebody who doesn't do oral sex, is obviously higher. We've done some studies in Kolebu. Colleagues have done some studies in Kolebu that actually show that the percentage of people with head and neck cancers that had HPV positive were rather on the low side. That is not to say that in our population, oral sex doesn't cause it.
Yes.
So once you are practicing oral sex, if we pitch you against somebody who doesn't practice oral sex, your risk is higher.
Risk is higher. But it doesn't rise to the point where there needs to be a medical warning about it?
Well, what I would say is that, as we said, cancers, we describe them in terms of risk-based, not necessarily causation per se, because we know that when we say causation, it means when A is present, B must happen.
Right.
But we know, because of the way cancers develop and the body's mechanisms to even curtail cancers, it doesn't mean always when you have even the exposure to the virus, you would have it. Now, it's just like saying, when you are crossing the road, look left, right, left again before you cross the road. Of course, there are many times you are going to jump across the road without even thinking. But it does not mean that that rule does not apply. So we will encourage you, if you can avoid it, that's better. Because the more you compound the risk factors, the higher your chances of getting it. Beyond some of the risk factors he's talked about, for example, is just normal, ordinary sunlight. Prolonged exposures. That's why we know a lot of fishermen who go to sea tend to come with lip cancers, because their lips are exposed and that. And then age. Just the fact that you are growing is enough for you to develop some cancers later on in life, because your body's ability to control how cells replicate, which is the major issue about cancers, uncontrolled division of the cells, becomes compromised. So imagine that you are getting old, you are drinking, you are smoking, and then you add oral sex. then you are just compounding your risks. So I think that's what we will take Batman's advice, I say, you know that song? Yes. He says, Enfambomu.
Enfambomu.
And yes, I bet how. Exactly.
Says the doctor.
Yes.
We've heard you. But I want to talk about the head and neck cancers.
Yes.
Are we recording? Like, what are you recording? What are the numbers looking? How are the numbers looking at?
All right. As Dr. Amankwah Boateng mentioned, one of the reasons we are having the program we are going to have tomorrow has to do with how do we begin to compile a well-structured national database for cancers. So you look at currently is the major centers that are compiling data, like Komfanoche, Kolebu, and a few places where cancers are seen. But we know that cancers are seen in different places at different times. Currently, what we can report are center-specific ones. So, for example, in the ENT department in Kolebu, the commonest ones are, for example, the laryngeal cancers. And it's supposed to be about the 6th commonest cancer in Ghana.
Please, can you explain that so that we can understand?
So the voice box is what we call the larynx. So the cancers that affect the voice box and its surrounding structures is one of the commonest cancers that are seen there. When you come to the oral cavity, then we call something the squamous cell cancers, the cancers of the skin, and then the lining of the mouth in those areas. Those are the common cancers that we are seeing in those places. But as I said, it's difficult to pitch that against the population because there are a lot of people walking around with cancers that don't even know that they are cancers. Maybe he can also provide a few statistics from 37.
Okay, so I think another interesting thing about the statistics has to do with even the age factor.
Yeah.
So Selormey mentioned earlier that most often than not, age above 50 is when we start to see cancers. Recently, one of our professors, Prof. Nati, did a publication. And what we are seeing in recent times that you are getting a lot more younger people. As I just yesterday, I think I did a biopsy for somebody 35 years. With a suspected cancer. So we are getting a lot more younger people between their 30s and 40s come in, you do the biopsy, it comes back as cancer. Unfortunately, in our part of the world, because we don't routinely do medical checkups, they come in advanced stages. And that also limits the options you have at treatment. And in the head and neck region, cancer once is there, one of the modalities I know will be going to that will be to cut the cancer cells away. Now, if you have cancer on your cheek, how much of your cheek can I cut away? When I cut away, how are we reconstructing it? So that's another huge challenge.
Are these young women or young men?
Yes, so both sexes actually.
Both.
Yes, both
What
sexes.
Are we not doing right? What are we doing wrong?
So it has to do with a number of things. One, I feel we are not researching enough. Because like we've established, we are not smoking much. Not to say we should smoke much, but a lot of our patients do not smoke, do not take that much alcohol. HPV appears to be low. So what is it that is causing us to see more of these cancers? We also do not do medical checkups like I mentioned earlier. So if you see some changes, some red patch, some white patch in the mouth, any ulcer in the mouth that's taking more than 2 weeks to heal, we do a biopsy. It's just a localized area. We cut it off and you are fine. So it's not like we are not getting cancers in Europe, the other areas. But they report early, so the management becomes easier. In our case, because of certain myths that we have, financial issues, health financing is another huge thing. So a patient comes to me with something I suspect to be cancer. If I do a biopsy, it's going to cost maybe 600, 300 in the clinic, 300 in the lab. If I want a CT scan of the head, 500 to 600 Ghana cedis. The average Ghanaian cannot afford this. Head and neck cancer is not on the health insurance. So they come, you examine them, you give them the initial cost. They are going to raise their money. It takes forever. By the time they come, it's increasing in size. The case I just mentioned, I think saw 3 months ago, and within just 3 months has increased in size over 10-fold.
Oh my
God. So that's another thing with cancers. Some of them grow very fast. So any delay, and then the management becomes compromised. So these are the things I feel off head we need to really take a look at.
Let me just add a bit. It has to do with lifestyle as well. Whilst the older population may not be smoking much, we are beginning to also see people do lifestyle changes among the younger population. They are drinking a lot more in terms of occasional drinking or recreational drinking. And then this bit about smoking.
Smokeless tobacco.
Not just smokeless, shisha and coal that have become, and there's this erroneous thought that shisha does not have, it passes through water and so has nothing in it. You are smoking shisha, the puff you are taking, you are probably smoking a number of sticks of cigarette. So let's be careful with those things as well.
Okay, well, our guests, Dr. Amankwah Boateng and Dr. Richard Selormey, are talking us through head and neck cancers, and already we've learned so much. When we come back, we'll try and figure out whether they can be prevented. If you're unfortunate enough to be diagnosed with it, what happens next? What's the treatment for it? Can it be cured? I mean, can you be cured of it completely? We keep hearing about early detection. How important is that? That's all to come when we return from these messages.
Your morning radio.
Thank you. All right, listen, let's get back into it. Dr. Amankwah Boateng and Dr. Selormey are here with us, and we're learning about maxillofacial cancers, right?
Okay. Head and neck cancers, yeah.
Yes, head and neck cancers. All right. Now, is it possible for me to ensure that I never get head and neck cancers? Can I prevent it?
Good. I like the second bit of the question. As we said, even if you did everything right, you are going to grow. And so far as you are growing, that's a risk anyway. So what we say is risk mitigation, to minimize your risks.
Right.
And yes, of course, you can do some things to lower your risks of getting cancers. The important thing is to target the risk factors that we've talked about, and thankfully most of them are lifestyle related.
Right.
So the commonest which we've talked about is smoking and then alcohol consumption. So one of the key targets in cancer prevention is having to do smoking cessation. But of course, we encourage you not to try to just get up one day and say, look, I've stopped smoking. That would be perfect, but we know that because it's addictive in nature, you would have to take your time. So we encourage you to look at it realistically. If you used to smoke 10 sticks a day, you can plan to step yourself down and say, okay, I'm going to manage this for the next 2 months, and then step myself down to say 8 sticks, and then go down gradually. Same with alcohol. But if you can stop in the shortest possible time, that's good.
Right.
The other thing has to do with lifestyle changes. We've talked about obesity being just a general factor, diet issues being a general factor. So eating a balanced diet, getting some good exercise on is also a good one. Of course, for those of us who have to be in the sunlight for very long and also get exposed to certain radiation, those of us working in hospitals, in the X-ray units or places where things like that, it's important that you begin to protect yourself as well. That is why you realize those who work in the sun use some sunscreen or sun protection as well. We also know that the oral cancers are related to some viruses, and so vaccination is becoming a good protection mechanism. So vaccination against HPV viruses, as done for females, has been known to also provide some sort of protection for against the development of some oral cancers, like we've talked about. So mainly lifestyle modifications are very important. The other bit is, as you can do all of these things, it may still happen anyway, as I've said. And that is where the next step of early detection comes in. And so checking yourself on a regular basis, once in a while, look into your mouth. Check your skin. Once in a while, notice the simple things. Your voice has changed a little bit. It's getting hoarse for quite a long time. I'm not saying when you finish your alpha hour and then you are talking. I'm saying if you have a hoarseness in your voice that is unusual for quite a long time, quickly get to the hospital. Oh, you think you've bit your tongue, but of course the tongue and the mouth tissues heal very quickly. It's one of the fastest healing in the body. So if this persists for more than 2 weeks, something must not be going right. So you should get to the hospital and get that checked early. Nowadays there are also what we call dyes, or some tools that we use to quickly check whether you have something going on. And it's just like a mouthwash. You wash and it sticks to tissues that are either beginning at the beginning stages of cancer or at cancer stage. And then those can be quickly handled for you rather than waiting until it's full blown and spread to other places. So those are some of the things. Maybe
Let me just
Could you-
quickly add.
And
okay,
also,
yes,
doctor mentioned the skin. So what are we looking out for?
with the skin, you would have to know what your normal is. That's the first thing. Everybody's skin is a bit different from the other person. So there are a number of things. Color, you have to look at the skin color, the texture of the skin, and any other groove that may be on the skin. Not all cancers will present like a big groove, a big ball like you see in my fist. So for the skin, one of the commonest is what we call melanoma. Like we have melanin, so melanoma. You will see that the skin, as you have it, is beginning to develop a certain darker spot. Like some people call it birthmark. Birthmark is okay, but then you begin to see that this quote and unquote birthmark like change in the skin is beginning to expand and grow bigger. Okay, that is a source of worry. Sometimes you also see a mole. You know what a mole is? That dark thing. Some of them have hair on them, some of them don't have hair on them, and then all of a sudden you see that it's growing out of its normal size. That is also some of it. Sometimes you also see the skin changing. It becomes as if it's an orange peel. Okay, where you see the pores becoming more prominent than normal. It may be a sign of something growing beneath the skin itself and beginning to cause problems there.
Right.
So there may be changes in the skin. And then sores, frank wound on the skin, which now all of a sudden will not heal much. You've tried all the things you are doing and it's not healing. Those are the common things you can see with skin cancers as well.
It's just anything out of the normal. So you need to know your
out of the
normal.
Right.
So know your normal.
Yes, I think so. On the skin,
Yes.
when he mentioned skin, he was referring to all the lining. So not just skin on the outside. He was also looking at the lining
In the
on the floor and the roof of the mouth. So you may see a white patch, a red patch in there that needs to be biopsied as well. What I wanted to quickly add is we mentioned these spaces in the face. We call them sinuses. And there's a myth to it. And what I actually want to bring up is the fact that because it's a potential space, sometimes you may have cancer growing in there without you seeing any external manifestation.
Exactly.
So you may just have chronic cold, your nose appears blocked,
All the
you
time.
do some cold treatment, it doesn't go, you move to another doctor, and you need to get to either an ENT surgeon or a maxillofacial surgeon, get a CT scan done. Because it's a potential space, it has about 15 to 20 mil. So you can have the tumor growing there without anything showing on the outside. And it is these minor cough and colds, especially because of where it is. If it's growing towards the nose, you get blocked nose, you may have some epistaxis. If it's going down towards the
epistaxis?
bleeding nose.
Okay, good.
Yeah. And then you may have it going down, in which case your teeth may start shaking. And that's where, for my general dental colleague, I also want to warn them. Once you have any mobile tooth, you look at the tooth, there's no cavity, you can't seem to find the cause. You want to take an X-ray or a CT scan before you take it out. Because what I see my patients coming with is, once you take that mobile tooth out, now you've opened the gateway for the cancer which was already there to now spread out. To the patient, because they didn't know, I went to take out my tooth and I got cancer. But the cancer is in that potential space. So if you did an X-ray, you see that there's some changes there, and then we'll do a comprehensive treatment. So that is very crucial as well.
Very important. Very important. Okay, so how do you treat head and neck cancers? What does typical treatment look like? What can a person diagnosed expect
For cancer treatment? Okay.
All right, so for head and neck cancers and for cancers in general, there are three main modalities of treatment, but of course there are a number of factors. So you are looking at the location, you are looking at the patient's age, you are looking at the stage of the cancer, you are looking at the general health condition of the patient, and then the type of cancer. So these are the things that are going to make you decide how you are going to treat it. I mentioned the fact that, especially for head and neck, because of the aesthetic role it plays, sometimes it brings limitations as to surgery. But there are three main modalities. So you're either looking at surgery, where you go and cut the diseased tissues away, or you could do chemotherapy or radiotherapy. In recent times, because of the morbidity. By morbidity, I mean the damaging effects. As in, if I go and cut the cancer away, there's the aesthetic bit, there's a functional deficit. So increasingly, other modalities are coming to play. So we are talking about targeted modalities or targeted therapies, immunotherapies, and other therapies that are more specific. But generally, you are looking at surgery where we cut away, chemotherapy, and radiotherapy. Yeah.
All right. Well, listen, you've really taught us quite a lot and really raised awareness on head and neck cancers. But there's a big thing happening tomorrow, the public lecture, starting at about 20 minutes to 10. Am I right? Oh, no. Oh, actually, no. That's just a note that has been presented to me. Forgive me. When does the lecture start? When does the lecture start?
Right. So the Ghana Medical Association every year looks at a topical issue, and we've noted, as we are discussing cancers, that cancers are becoming a serious problem. And so it's an epidemic as we stand. Many places are beginning to see cancers, and young, productive people are being affected. As we have mentioned, many of us see patients who are present at later stages. So typically you can't cure them. They either manage them until they die, or they will have serious defects as you treat them. And that is why the Ghana Medical Association has decided to center this matter at the public lecture, which is themed the epidemic of cancers in Ghana, increasing access to prevention, early detection, and treatment. And we'll be discussing various issues. For example, when people get cancers, some of them are even stigmatized. It is thought that they are cursed. Then there are the cost issues. Affording, as we've discussed, the biopsies, medications, and other things.
The fact that the NHIS doesn't cover.
Head and neck
Of course, not all of them. You have people going through the treatment and having to lose all their hair. And then various issues, policy issues, documentation, the research bit that Dr. Amankwah talked about. And we want to have this discussion. It will be happening at the Movenpick Ambassador Hotel from 9 o'clock to 2 o'clock. We have patients who are living with cancer, patients who have fought and, should I say, defeated cancer on stage. And then we would also have the policymakers from the Ministry of Health. NHI is going to be there to look at the financing of cancer. Recently, they've added some pediatric cancers, and we know we are advocating as GMA to add a few more to it to reduce the burden on people. But they will also be on the panel. We also look at the clinical psychologists to look at the psychological issues around cancer. And it will be happening at 9 to 2 p.m. And we are doing this in partnership with Roche, and also your good self, Joy FM, is going to be there to live stream it. If you can't be there, you can join us on the Facebook page of the Ghana Medical Association, or the YouTube page, or our website. And then Joy FM will also live stream it. So just be there. We are encouraging the public to join in. You'll be allowed to ask questions, both online and in person. Right. And hopefully out of this, policies and other important decisions will be made, as GMA always leads the way for various policies to be discussed out of our public lecture.
Lots of you have been sending your tweets, and as you can well imagine, there's a lot of interest in this whole thing about the oral sex. And but you've really
Mama V's question.
Mama V's question, yes. Mama V's question. Mama V's pastor will very soon be calling her.
Next thing we know, Mama V will patent the name.
So Kojo is trying to get us those messages that have come through. But I also want to say, give an update on the Pop Chain community outreach. So here at Joy FM with our partners, we've also been supporting the whole cancer awareness. We've actually gone to Ejumako, Enyan, Esiam district.
Yes,
we did some screening, about 800 men and women, and we have about 10 suspected cases. So that's where we are with the project, and we will be moving forward from there. We're bringing all the women and men discovered. I think they're mostly women. We're bringing them to Accra so that they can go through the rest of the procedure.
That's a good contribution. And somebody might think 10 is a small number. When you talk of cancer, that's big compared to the population that you screened.
Right.
GMA is always willing to support it anyway. So once you let us know.
We thank you. And to our listeners, the pop chain will be coming to you because we will need a lot of money to continue from where we are. So thank you for supporting all the projects in the past, and thank you for supporting the projects in the future. And thank you, GMA, as well.
Yeah.
Thank you, guys. Dr. Yao Amankwah Boateng, Senior Specialist of Maxillofacial Surgery at 37 Military Hospital. He's a fellow of the Ghana College of Surgeons. He's a member of the Ghana Medical Association. Speaking of which, their acting General Secretary, Dr. Richard Selormey, is our other guest. Now, there's something you guys might not know about Dr. Selormey. You remember in 2017, when Joy FM joined up with the First Lady to do the mother, the Save a Mother, Save a Child campaign in Kumasi, where 4 babies were dying a day because they didn't have incubators, and we stepped in a big way. Mama V, you and I hosted a live show from Konfanochi Teaching Hospital. Well, did you know that none of that would have happened if not for Dr. Richard Selormey? Because Seth Kwame Boateng, who did the documentary which sparked the whole campaign, had gone to Konfanochi to do a different story. And Dr. Selormey saw him and said, Joy FM, come here. And took him to the mother and baby unit that existed at the time. Showed him the abysmal, conditions there. He came back, talked to Elvis Kwashi of blessed memory, and before you knew it, we were on the case with the First Lady, giving us a lot of support. First and Second Ladies actually giving us a lot of support to make that life-saving campaign happen. So, Dr. Richard Selormey, if you have, if your career ends today, you would have made a massive contribution to the healthcare situation in your country, and we thank you for that.
It's reciprocal. I think Joy FM did a great job at that, and I think the actual building is up and doing. There's been some delays, and I think it's a big legacy of Joy. That is one thing that I think the media can collaborate and actually do a lot in society, and I believe Joy FM is a leader in that. Thank you so much for that.